Hatford Pharma welcomes you to the ocean of practical knowledge about small animal practice. That is Hatved's YouTube channel. We are thankful to Dr. Vinod Kumar for sharing his practical tips with fellow veterinarians.
Hello, my dear friends. So, regarding vector-borne diseases, we were discussing lot of information regarding the commonest vector-borne diseases found in our field conditions in our day-to-day clinical practice. And on the first day, we discussed about the commonest vector-borne diseases in dogs and cats and their clinical presentations, their pathogenesis, their methodology of diagnosis, and the cheapest diagnosis, the fastest diagnosis, and the most possible diagnostic approach. As we have seen, the easiest diagnostic approach and the commonest diagnostic approach which we can employ from our side is a thorough clinical examination with anamnesis followed by a thorough blood smear examination. Whatever it be, see, in theileriosis, if we suspect the most important production disease, theileriosis in the cow, what we used to do, we can judge something from the clinical signs. Of course, there are a lot of doctors, expert bovine clinicians, who can simply by seeing the cow itself, they can say it could be theileriosis. But how can we diagnose it? There is a written protocol for it. We have to take the aspirate from the lymph node, especially the prescapular lymph node of the cow. We have to make a thick smear. Then we have to stain it and examine under the microscope so that we can see the coaches blue bodies. Likewise, trypanosomosis in the cow, babesia in the cow. So all these needs clinical examination followed by blood smear examination with the experienced eye. It is better if we have in our locality an expert doctor who has typically good knowledge, skill and interest in blood smear examination. If in a locality one such doctor is there, all the smears can be presented to him or her and he or she can examine those blood smears and tell whether it is positive for Anaplasma platys, Anaplasma phagocytophilum, Babesia canis, Babesia gibsoni, Hemobotryla canis, Hemobotryla felis, all those things. He can well differentiate. There are no lot of things there. Lot of things are there. We have only a few things, just numerable things, like all those I mentioned now. So, it is better somebody should be there to look after this exclusively. Or if ourselves, if we personally are equipped, we can do it. Of course, from my part, I am very poor in making a smear. That is true. Even though I teach to make a thin smear, I am poor to make a thin smear. Whenever I make a smear, it will become thick. See, that needs lot of experience. It's a skill to make a thin smear. Staining, of course, I used to do very regularly. And looking through the microscope, of course, it is our job. It is a doctor's job. It is not the technician's job to look to it. It's our job. We only know what is extraerythrocytic, intraleukocytic, intraerythrocytic, intrathrombocytic, all these technical terms and their versatilities, we only know. We can think of it, my dear friends. So today is our last segment of webinar in our vector-borne disease series. And yesterday and day before yesterday, we studied a lot about the various vector-borne diseases. As on day before yesterday, we studied about various diseases, their pathogenesis, their occurrence, their diagnosis, etc. And yesterday, we discussed about various diseases, their managements, their complications, and those tips in clinical practice which I developed throughout my 25 years of clinical practice, which were transferred to you. Say, I was not hiding anything at all. All those things which I have developed personally, I am transferring to you only. I don't want to hide anything and I will never do it. And so, these are not secrets. Maybe somebody think that it is secrets, but this cannot be termed as secrets because knowledge is to transfer or experience. The knowledge gained from experience is to be transferred. Then only it can become propagated. So that I am doing it. Now we are coming to the third and the last segment of the series, the effective vector control. So we studied about the vectors, various vectors producing various diseases, and how to control these vectors. In fact, this is a hell of problem, everybody know. Earlier, ticks and fleas were highly sensitive to fenvalerate. Nowadays, if you put fenvalerate powder, they will eat the fenvalerate powder and dance on the body of the dog. Or the same happens with the carbaryl. Same happens with propoxur. To a certain extent, amitraz will do. Ivermectin previously, when we were in the college days, there were only one ivermectin. That was the Glaxo's Neomec. Neomec had 1 ml ampule. And that was ivermectin used. And that was a pure form of ivermectin also. When it is injected, I several times saw that all the ticks which were biting the dog paralyzed and fell down. Nowadays, even overdoses of ivermectin will not give any effect. That means the ectoparasites have attained that much of resistance. So we have to go for new antiparasitic drugs. So that we are going to discuss these things in this webinar. And warm welcome to all the members, all the doctors, the eminent personalities from various parts of the country, right from Kashmir to Kanyakumari district. So, let me tell something about parasites of animals. Parasites of animals are endoparasites and ectoparasites. Of course, I was just teaching like teaching the first standard students. No, no, no. I am well aware that I am treating or I am dealing with very eminent personalities all over my country. And with due respect, let me go through the basics. Like parasites of the animal, we have ectoparasites and endoparasites. The endoparasites, of course, it is a different one. We have nematodes, we have trematodes, we have cestodes. All these things are entirely different. These are helminths. Of course, that is another one. But the ectoparasites, we are dealing with these vectors such as the ectoparasites. The ectoparasites can be those parasites which are visible to the naked eye and those parasites which are not visible with the naked eye but visible under the microscope only. Those which are visible with the naked eye is the macroectoparasites, and those which are not visible and visible only under the microscope is the microectoparasites. The macroectoparasites we know very well. Those are the ticks, fleas, lice, and the flies. Ticks, fleas, lice, and flies. And the microparasites are, we know the mites. You have different types of mites. The main one is Demodex, then the Hyalurona, the Autodactys, the Cyanodactys, the Sarcoptes, Sauroptes, Dimodocoptes. All these are their mites are their microscopic ectoparasites. These ectoparasites, as we studied yesterday and day before yesterday, they transmit certain diseases that we all know because we came to know all these things yesterday and day before yesterday. Like the Dermacinder variabilis and Dermacinder andersoni, those are the wood tick, and the deer tick. They can transmit Babesia canis. Nowadays we have a lot of deer ticks in our own territories. Even though they are known as deer ticks, they are not carried by deer to our house. No deer is coming to our house. But the deer ticks are there. The dogs are carrying these deer ticks. Then we have the Haemophysalis ticks, abundant in our premises. They can transmit Babesia gibsoni, Ixodes, which transmits Anaplasma phagocytophilum, Repisophilus, or the commonest tick, the brown dog tick, the largest dog tick, which transmit Anaplasma platis. Of course, we know Anaplasma phagocytophilum produces canine granulocytic ehrlichiosis. Anaplasma platis produces canine cyclic thrombocytopenia, which is transmitted by Repisophilus. Hepatitis 1 can is transmitted by Repisophilus sanguinis. Bartonella, the Bartonella henselae, cat fever, transmitted by Ixodes. Borrelia, Lyme disease, transmitted by Ixodes. Leishmania, which is transmitted by Phleotomus. Filaria, which is transmitted by mosquitoes. We have the Anopheles mosquito, Aedes mosquito, and the Culex mosquitoes. They transmit microfilaria through their salivary glands and through their appendages. They will pass on this microfilaria to our system or the dog system. Then the hemoplasmosis, that is the Mycoplasma haemocanis, Mycoplasma haemophilus. These are the two things which are transmitted through the respective fleas, dog flea and the cat flea. So, it is inevitable or it is essential that after a disease treatment process, we have to conduct eradication of the ticks or eradication of the ectoparasites. Sometimes with a wrong treatment, we can undertake intensive canine eradication program. So we should not go for that intensive canine eradication program. We have to go for intensive ectoparasitic eradication program. For that, I am just compiling all the knowledge, the ideas and practical experience you have, collecting all these and organizing this and giving to you enriched with my experience. First of all, let us study about the life cycle of these ectoparasites. Now we are concerned with the macro ectoparasites, those are which can be seen with the naked eye. These are the ticks, fleas, lice and the flies. Let us take the first one, the tick. So if we have to study how to eradicate the tick, we have to study the life cycle of the tick. It is so simple to study, but it is a wonder that who studied on this life cycle. He might have taken too much, he or she might have taken too much of pain to study the life cycle, to make it into thesis and then submit for the MVSc or PhD. I don't know, we have to bow before them at first. We are just studying ticks, nymph, larva, etc. All these things we are studying. So, ticks are the first ectoparasite to be studied. These ticks are 8-legged parasites, 4 legs on one side and 4 legs on the other side. They are purely Draculas or blood drinkers. They can feed only on blood. They will eat or drink only blood. They can feed only on blood. They will bite to the skin. They will prepare a dip or a cavity or a crater or a hole on the skin. They will dig deep into the crater. They will embed their mouth parts by puncturing it. They will introduce their mouth parts into it, and for weeks or months they will drink the blood continuously. Sometimes you can see the unengorged ticks which are very hungry. They are in search of a nice place to hide and eat the blood. So when it digs a crater and digs deep into it, embedding the mouth appendages and the mouth parts into it, it will not be engorged. But by drinking the blood, they will become slowly engorged, and inside the abdominal cavity, they have thousands of small cavities, compartments. And all those compartments will be filled up with this drunken blood, and they have to drink blood, and the blood should not clot. For that, they are actually injecting some anticoagulant to the area, drinking as much quantity of blood. After when all the compartments inside the abdominal cavity is filled, as I said in the anorexia, webinar, there is a satiety center for that tick also. That satiety center will be stimulated so that it will become enough with what it ate. Okay, सब कुछ खत्म होता है, they will stop eating or drinking the blood, and what they will do? They will release their mouth parts. As when they release their mouth parts, they will fall down. They will fall down and they will slowly crawl to, see, they will be very large by that time. And they will slide slowly, they will crawl to some hiding places inside the kennel itself or in the mud, in the soil. They will be hiding there, and they can live up to 6 or 7 or 8 months continuously without even food, because they are enough with what they drank. They ate or they drank lot of blood. That is enough for giving nourishment for their whole lifetime. And during this lifetime, it will be laying eggs. Those eggs will hatch out and they move very slowly only with the 8 legs. Like a spider, they move very slowly to find out a host, and they will climb the host. The host can be anybody. See, this Repisophilus sanguinus is not so host specific. It can climb onto a dog or a cat or a cow or a buffalo or a goat or even human beings. But when they bite us, we will come to know and we will kill it immediately. So they can drink anybody's blood. So we are concerned with the dog and the cat. So they will climb onto the dog again, the young ones. They are hungry. Oh, I am hungry. I need a dog. I need a dog. They are always hungry. They will go in search of an animal. Especially we are concerned with the dog. They will climb upon the dog. They will start drinking the blood, feeding the blood, engorging, again falling down. They will be moving to some crevices or corners, lay eggs which will hatch out, and the process of the cycle is being continued.
Hatford Pharma presents Pantohat, proton pump inhibitor systemic drug. A powerful tool to prevent and treat gastric ulcers and esophagitis. Pantohat IV injection. Pantoprazole 40 mg vial. Indications: to prevent and treat gastric ulcers and esophagitis. Dosage for dogs and cats: 0.7 mg to 1 mg per kg over 15 minutes once daily. Route IV. Presentation: 40 mg vial. Pantoprazole sodium tablets. Pantohat 40 tablets. Pantoprazole 40 mg. Indications: to prevent and treat gastric ulcers and esophagitis. Dosage for dogs and cats: 1 mg per kg per day. Route: oral. Presentation: 1 into 10 tablets. You can book your order online at www.hatvet.com. Looking forward to a long-lasting business association. Thank you.
This we call as a life cycle. So, from this we should have to know that the ticks have an on-the-host life cycle and an extra-host life cycle. It has on-the-host life cycle as well as the extra-host life cycle. Both the stages, the young ones such as the nymph and the adult, can be found on the floor as well as the dog's body, dog skin. Okay, even in ticks, whatever be the tick, let it be Dermacinder, let it be Repisophilus, let it be Umbilioma, let it be hyaloma, let it be hemophysalis, whatever be the ticks, the young one of the tick, this is a general life cycle of a tick, and even the young one of a tick will be highly infective. This is another point we have to take into consideration. The young ones, so that the young ones also should be destroyed. So, infestation with the tick on the skin is known as acariosis. See, I have written it. I have written the technical term. It is acariosis. There is acariosis on the dog. That means there is tick infestation on the dog. Got it? Don't forget this technical term. It is acariosis. Acariosis. And all these ticks, when they are found huge in number, they can drink blood, and at the same time they can inject certain things into the blood. Number one is they can transmit certain diseases or disease producing organisms like this Babesia, Canis, Gibsoni, Anaplasma, or whatever it be. And at the same time, their mouth parts or the salivary glands produces certain neurotoxins. And these neurotoxins also will be transmitted into the host body, and these neurotransmitters can produce tick paralysis. Yesterday we studied about it. We know how to deal with the tick paralysis also. Sometimes I have seen that tick paralysis usually resembles rabies. So we have to differentiate. The rabies will not have a pale conjunctival mucosa. We have to differentiate. So that is acariosis. So now we have come to know about the life cycle of these ticks. And the ticks, I have said that the life cycle is on the host and outside the host. They remain infective outside the host for several months. Young ones are also infective. The adult ones are heavy blood suckers. They can drink as much as blood as much as 0.1 ml per kg per day. 0.1 ml per kg. One tick can drink 0.1 ml per kg per day. You just imagine there is one tick on the body. So for one day, how much of blood they can drink? 0.1 ml. It is a 30 kilogram weighing Rottweiler. So 0.1 into 30. That is 3 ml. Yes, 3 ml. 3 ml per day. Suppose it is having 100 ticks. 100 into 3. 300 ml. So imagine 300 ml of blood is being lost due to the bite of 100 adult ticks on the body of that 30 kilogram weighing Rottweiler. That is per day itself. On the second day, it is again drinking 30 ml. For a week, it will be eating 30 into 7. So 2 liters of blood they will be drinking. So we can imagine how much is the hemorrhagic anemia which is produced. So, but this will be compensated anyway. All this blood drinking and loss of blood, that is a hemorrhagic anemia, will be compensated by the hematopoietic system, so that the erythropoietin will work. It will come out from the renal parenchyma. They will induce stimulation of the bone marrow to mature more number of erythroblasts. That is known as erythropoiesis. That occurs. But for hemorrhagic anemia, more than anyone, we need lot of iron injection. So reserve iron. That is why generally we give iron injection in hemorrhagic anemias. Okay. So that was simply regarding the blood loss in acariosis. Anemia is very common. It is blood loss anemia. It is hemorrhagic anemia. medication should be done on the host body as well as the kennels. Why? Because we know that the kennels always will be infested with the young ones as well as the adult ticks. So we know the Repisophilus ticks. We know where all these Repisophilus adult ticks are hiding on the body, especially the ear. On the ear we have the margins, we have the uh, pocket of Morgan. Pocket of Morgan is seen on the ear as a cleft. You might have seen it. Sometimes you can see the Repisophilus which is biting and lodging inside the Morgan's pocket. And also on the ventral sides, the medial thighs, on the ventral neck, on the forehead, and even on the eyebrows. It will be biting everywhere and bringing blood very comfortably. So that is Repisophilus, the brown dog tick. So in the brown dog tick, the Repisophilus, all this is adult one as well as the young ones. These are all the young ones. Everything will be infective. Young ones will be very hungry. They will feed hungrily on blood and they will become engorged like this. These are the same Repisophilus itself and both are infective. So we have to control both the stages, the adult as well as the nymph stage. Here also you can see this is a very common picture where all the doctors have encountered and seen. Highly infested acariosis. Lot of ticks can be seen which are making craters and drinking blood from the dog's body, the skin. This is an engorged adult Repisophilus tick which is commonly known as the brown dog tick, Repisophilus. And when it has not drunk blood, it will not be engorged, and you can see like this, unengorged Repisophilus. So Repisophilus is the commonest dog tick and it has a biphasic life cycle where it is seen on the host body as well as outside the host body. Then the Dermacinder, we have the deer tick, Dermacinder variabilis, and we have the wood tick, that is Dermacinder andersoni. So Dermacinder also is very commonly seen in dogs. This is an unengorged form of Dermacinder. But see, you can see the difference between the brown dog tick and the Dermacinder. The brown dog tick is completely brown. This is not so. And see the thorax. The thorax is well defined in the Dermacinder. See the Dermacinder with the thorax. 8-legged parasite, Dermacinder. Then we have the Ixodus with a well demarcated thorax. You can see the well demarcated thorax with the prominent mouthparts. Ixodus ricinus is the commonest dog tick. It can infest dogs as well as farm animals. So Ixodus, they are powerful bloodsuckers. When they ingest blood, they becomes like this. So you can see the engorged exodus with blood. This is exodus which is engorged. Then we have the Umbilioma, Hyaloma, etc. These are all commonly infesting dogs as well as farm animals. Umbilioma. This is unengorged form of Umbilioma, and here you can see the blood drunk and completely filled up or engorged form of Umbilioma. And you can see this Hyaloma tick. This Hyaloma tick, you can see the joints of the legs will be discolored. Joints of the legs will be discolored.
Hatford Pharma presents Rajdox injection, suspension and tablets. The safe option of antibiotic to beat resistant infections. Rajdox injection, doxycycline hydrochloride 100 mg vial. Route IV. Presentation 100 mg vial. Rajdox oral suspension, doxycycline monohydrate 50 mg per 5 ml. Route oral. Presentation 60 ml. Rajdox LB 100 tablets, doxycycline hyclate 100 mg plus lactobacillus 60 million spores. Rajdox LB 200 tablets, doxycycline hyclate 200 mg plus lactobacillus 60 million spores. Rajdox LB 300 tablets, doxycycline hyclate 300 mg plus lactobacillus 60 million spores. Indications: leptospirosis, ehrlichiosis, anaplasmosis, Lyme and bacterial infections. Dosage for dogs: 5 to 10 mg per kg twice a day. For cats, 10 mg per kg once a day. Route oral. Presentation 1 into 10 tablets. You can book your order online at www.hatvet.com. Looking forward to a long-lasting business association. Thank you.
See, non-pigmented joints. There is a typicality of Hyaloma. The same can be seen in mosquitoes, Aedes mosquito also. So that is Hyaloma tick. This is another powerful bloodsucker, the Hemophysalis. And these were the ticks which are found on the dog's body. So now, regarding ticks, that is acariosis, we have seen how the acariosis occurs on the body, the life cycle, the common life cycle of the ticks, and where it is found. Now we are going to the second macroparasite, that is a flea. Other than the tick, the flea is high because the ticks, as we said, it is crawling very slowly. It won't create any nasty problems like biting voraciously and chewing, etc. And doesn't produce any much irritation like the fleas do. But the fleas, they create a hell of nuisance. Flea is a big problem all over the world. The dog flea or the cat flea, whatever it be. Because the fleas, they move very quickly. They crawl very quickly. They can even jump from one place to another place. They have no wings, but they will jump as if they are having wings. They will fly like. They will jump from one place to another place. To catch them is also somehow we have to identify whether it is a tick or a flea. If you are going to catch it, they will move very fast. We cannot catch them. And this dog flea and the cat flea, the flea are laterally flattened and they feed on blood. They are very powerful blood eaters. That is hematophagy. The problem with it is it releases from its mouth parts and other body parts lot of allergens. They will irritate the cutaneous tissue and too much of pruritus occurs. Either they will be scratching the whole body all the time, they will be biting and chewing the body parts, biting and chewing the skin, so that some fleas will be ingested. They will be eating some fleas and swallowing some fleas. So, infestation of the skin with flea is known as tulicosis. Tulicosis. So, other thing was acariosis, this is pulicosis. So, pulicosis, I say it is little bit more dangerous than acariosis. Why? Because they release so many irritants, and these irritants will irritate the cutaneous tissues, producing pruritus, chewing, and sometimes even self-inflicted injuries by scratching with their claws and biting and chewing of the affected parts. They do not have wings, I said it. They are compressed laterally and have hairs and spines, so that they can jump like a fly, they can fly. But literally they don't have wings. So, adult fleas will live on dogs and cats, feeding on their blood, which is required by the female flea to produce their eggs. The female flea will ingest blood about 15 times her body weight and lay about 25 to 50 eggs a day. The eggs are laid on the animal but will fall off into the ground or onto the carpet, usually close to where the pet spends most of its time. Eggs usually hatch out in about 2 to 12 days, depending on the temperature and humidity. The larvae that emerge from the eggs have no legs and can only crawl a short distance, so most will be near the pet's favorite resting place. The flea can remain as a larva for 2 to 20 feeding on organic materials. The larvae changes into adults after spinning a cocoon, which may take from 7 days to 1 year. The adult flea emerges from the pupa and jumps onto the pet to begin the cycle all over again. The feeding of the fleas will cause irritation, so that dogs and cats will constantly scratch and bite itself. Severe flea infestation can make the pet's life very miserable and can lead to allergic dermatitis and anemia. Fleas can also transmit tapeworms and hemoplasma. So, see, anybody can read like this. No, I'm not going to read. I'm going to describe with mimicry. See, these are fleas. We have two fleas, the dog flea and the cat flea. The dog flea is Tenocepharidus canis and the cat flea is Tenocepharidus felis. Of course, we know the importance of the dog flea. The dog flea, in their gut, they harbors the eggs of the longest tapeworm of dog, which is it? Dipylidium caninum. We have 3 tapeworms in the dog. Number 1 is Dipylidium caninum, which is the longest tapeworm. Number 2 is the Diphyllobothrium latum, which is a fish tapeworm. Number 3 is the Echinococcus granulosus, which is very important, that it is highly host specific, smallest type of the dog, and if it undergoes development in other non-host animals such as the cow or the goat or the human being, the larva cannot propagate, the larva cannot develop, and the larva undergoes encystation. So what will happen? This cyst we call as hydatid cyst. So I wanted to ask you one question. Is hydatid cyst a feature of dog? No. See, the same question arised some time before in one WhatsApp group. There was a question with circling of the dog, and somebody answered it could be hydatidosis. There is no hydatidosis in the dog because dog is the definitive cause for the Echinococcus granulosus. So that is another thing, we leave it. So what happens to the flea? They are voracious, powerful bloodsuckers. They will suck the blood. They are fine on the body, and they will say that I am fine, and they will be on the body. They will suck enough blood, and they will mature up. They will start laying eggs on the skin itself. The eggs for some time will be sticking onto the hair, the fur. We say the knit. Then the eggs will fall down on the floor. This will hatch out, and they form the larva. The larva, you know, they are not like adult fleas. They have two problems. One, they have underdeveloped limbs. Underdeveloped. They have only rudimentary legs. They cannot crawl. Number two, they have an underdeveloped digestive system. So with that, how they can survive these young ones? These young ones, when they are hatched out, by that time it will be happy. Oh, I have seen the beautiful, colorful world. Now they are seeing the colorful world and they are very happy. But sometime later, slowly, that hunger arises. They will tell, oh, I am hungry, I am hungry. But what they can do, they have no food. They cannot crawl to the food. They can move to the food. They have no legs. And also they have underdeveloped alimentary system. What they can do? Their mother is on the top of the dog. Okay, their mother is there. They will cry to the mother, oh mother, oh mom, I don't have food, I am very hungry, please give me food, please give me food. They will cry loudly like this. By beating their chest, they will cry, give me food, because they are hungry, they cannot eat anything. And their underdeveloped digestive system is there, they cannot digest any food which is being taken from outside.
Hatford Pharma presents Clindahat range, Clindahat syrup and tablets, lincosamide antibiotic systemic drug, a weapon to fight deadly infection with care. Clindahat tablets, clindamycin 250 mg tablets, clindamycin 600 mg tablets, Clindahat syrup, clindamycin 25 mg per ml. Indications: skin infections, dental, osteomyelitis, and protozoal infections including toxoplasmosis. Dosage for dogs: 5.5 mg to 33 mg per kg every 12 hours. For cats, 11 mg to 33 mg per kg once a day. Route: oral. Presentation: 1 into 10 tablets, 60 ml. You can book your order online at www.hatvet.com. Looking forward to a long-lasting business association. Thank you.
Whatever it be. They cannot digest blood directly because they have a underdeveloped alimentary canal. What happens here? The mother flea is there on the dog's body. The mother flea will hear the cry of these young ones. Oh my God, my children are crying there. Children are devoid of food and they are crying on the floor. Oh my God, what can I do? Immediately they know, the mother knows what to be given. My children, they cannot digest blood. They cannot digest parota. They cannot digest chicken fry. They cannot digest paneer. So what should I give? They have an underdeveloped digestive system. So what should I give? I should give some semi-digested material which is delicious to them. So what the mother will do, the mother will start eating too much of blood. And the semi-digested species will be passed on to the skin. All the semi-digested feces will be passed to it. As it eat too much of blood, it will pass semi-digested food, which is passed on to the skin surface. This is what, when we comb, we get the flea dirt. This is the flea dirt. The young ones are waiting there. Oh, mother, give me something to eat. Give me something to eat. Okay, they are seeing that the mother is eating too much. Now we will get the food. What is their food? The semi-digested stool of the adult fleas. These semi-digested stools will fall down slowly. And immediately they will grab it, they will swallow it. The young ones. The young ones are then happy. They get the food. They can be easily digested because 50% is digested by the mother. So that is a flea dirt. Actually, I was telling that the flea dirt is a beneficiary process by which the young ones are fed by the active mother. Okay, that is regarding the flea dirt. And now, after eating that lot of flea dirt in the floor, what they will do? They will eat the lot of flea dirt which is being supplied by the mother. The mother will supply the flea dirt. As there it is semi-digested feces. They will eat the semi-digested feces. They will become a more powerful youth, a youth flea. But the development will not be complete. Okay, अभी तो ठीक है माँ, ठीक है, बस. They are satisfied with what their mother has given. Now, after when the tummy is filled, what they will do? They will go to a samadhi. They will sit like this. They will themselves spin a cocoon around them. Spin a cocoon around them. They will spin a cocoon around them. Before that, they will move to a very comfortable area so that nobody will come and disturb them. They will spin a cocoon around them, that is known as a pupal stage. They will pass on to the pupal stage and they will be inside the pupal stage. They will be inside the cocoon at the pupal stage for up to even a year. They will be there. And after several months, like 5 months to 1 year, they will develop inside the cocoon. As the pupa will develop and they will emerge into an adult. As when they will develop into an adult, one fine morning they will break up. They will break up the whole cocoon, coming out like this. Yeah, I've come out. Now I am an adult one. Adult flea has come out. They are becoming extremely happy because they are seeing the world again as an adult flea. But at the same time, they will feel that hunger. Oh, ma, I'm hungry again. They are hungry because they are productive adults. The life cycle has to be completed. They are adults, and by this stage, It has to climb onto the host. See, it is not like the tick. The fleas are highly host specific. So what they will do, the Tenocephalitis canis is highly dog host specific. They can survive only on the dog's skin. They can survive only on the dog's skin. So what will happen? They have to go in search of a dog because they are highly host specific. So what they will do? With a burning stomach, see, they want to drink blood at the earliest. With a burning stomach, they will be wandering hither and thither. They can move very fast. They will be wandering hither and thither in search of a host. They need only a canine. If it is a Tenocephalitis canis, it needs only the dog or the Canidae family. If it is a Tenocephalitis felis, it needs a cat only. So what they will do? They will be running hither and thither for their host. At last, they will find it. See, the God has given another power. Simply they cannot say, their dog is coming, and simply they cannot jump. No. They cannot see it with their eyes. They will sense it. They are highly shadow sensitive. They will be keeping themselves like this. They will be hiding there. And when an animal is passing through, the shadow will be coming, shadow will be falling on the flea, and they are highly shadow sensitive. When the shadow falls on it, it will immediately jump onto the limb of the host. They are highly shadow sensitive. They will jump onto the limb of the host. They can jump up to 15 centimeters. They will jump because a shadow has come. Sometimes I will be going through it, through the way. He will jump. Oh, I got a dog. He will jump and he will bite my leg. Immediately after biting, what will they do? They will taste it. They are highly host specific. They will come to know that it is not a dog, it is a human being. They will release the bite and they will fall down. Again, a cat will be going through that way. They will jump onto the cat and bite, and they will see that it is not a dog, it is a cat. They will jump again, release and fall down. They will be very unhappy 5 or 6 times. After so many times, a member of a dog, Canidae family, maybe a jackal or a wolf or a hyena or a dog or anything we will be passing through. Not a hyena, sorry. A jackal or a wolf or a fox or a dog or a dingo may be passing through. And they will jump and they will bite and say, okay, my host has come, it is a dog, and I am they will be very happy. They will eat, they will drink the blood, they will pass on to all the body parts. They will move through all the body areas. They will be biting hither and thither. So all these animals will be then directly scratching and biting on chewing on that area. They will be ingesting some fleas. They will give a way for dipleading caninum also. So the dipleading caninum also will be propagated inside the dog's stomach. At the same time, they can drink lot of blood. They will become very happy. They will drink lot of blood. Thereby they can lay eggs. And the eggs again, they will be falling down. It hatches. The same cycle continues. Now you got to know how the life cycle of the flea is. This is a problem with flea eradication. They can live outside the host, that too in a well-equipped cocoon up to even 1 year. And naturally, this cocoon is resistant to almost all the chemicals what we use. That is why it is said it is very, very, very difficult to eradicate the fleas, because even though we are eradicating the emerging generation on the body of the host, the old generation or the new adult emerging cocoon is there in the crevices and corners of the kennel. For that, if you use any anti-flea formula, it will not kill the cocoon. It cannot destroy the cocoon. So for destroying the cocoon, what can be done? The only method is to burn the cocoon by fire. Burn the cocoon by fire. Okay. So that is why in all the textbooks it is said that burn, put fire to the crevices and corners so that the cocoons will be burnt off. Okay. So, and now I think you have got a clear idea of what the larva is doing on the body. The fleas can transmit the longest tapeworm, that is the Dipylidium caninum, as well as our dangerous hemoplasma.
Hatford Pharma introduces Iverage DT16 tablets, ivermectin 16 mg, antiparasitic systemic drug. Give a solid punch to worms attack. Ivermectin 16 mg tablets, Iverage DT16 tablets. Indications: in dogs, ivermectin is FDA approved only for use as a heartworm preventive. In cats, it is FDA approved for heartworm prevention and control of hookworms. It has also been used as a microfilaricide, ectoparasiticide, and endoparasiticide. In dogs, used for generalized demodicosis and sarcoptic mange, shelteliosis. Dosage for dogs: 0.2 mg to 0.4 mg per kg once a day. Route: oral. Presentation: 1 into 10 tablets. You can book your order online on www.hatvet.com. Looking forward to a long-lasting business association. Thank you.
The dog flea can transmit Mycoplasma haemocanis, and the cat flea can transmit Mycoplasma haemophilus. We know it. This is the dog flea. See, it is bilaterally flattened. You can see the powerful mouth parts and the hairy limbs. This is a Tinocepharidus felis. Now, so here, when you are undertaking a treatment against fleas, an anti-flea formula, we have to undertake it very strongly on the body of the host as well as outside. The outside emerging generation, to destroy them is a Herculean task. For that, what we can do, we will study. Then the third one, louse. Louse we all know. So now we have studied about acariosis and pulicosis. Louse. Louse, we have two types of louse which infest the dog: the chewing louse and the sucking louse. The chewing louse is Trichodectus canis, which is brown in color, and the sucking louse is Rhinonathus setosus, which is white in color. So it is very easy to differentiate from the morphological features. The chewing louse are not sucking blood. They will chew and they will eat the epithelial cells only. But the sucking louse, they are powerful blood suckers. And so the same thing arises, like the chewing louse will not produce any anemia, but the sucking louse produces anemia. See, we have studied ticks and fleas, their life cycle. And they have a life cycle where some part is on the host and some part is outside the host. But the life cycle of the louse emerges or starts on the dog skin, ends on the dog skin only. So that means they have a life cycle only on the skin of the dog. They are not going anyway. They are not going out for completing their life cycle. They have no extra host life cycle. This is very important as when the eradication of flea is concerned, because you have to give the treatment on the for dog body only. Need not worry about the surroundings because they have no development outside. Okay, so we now know that the brown dog louse, it is the chewing louse, it is Trichodactylus canis, and the white dog louse, which is sucking louse, known as a Deinonychus setosus. The human louse is scientifically known as Pediculus hominis, and the term pediculosis was taken from human louse infestation because it is Pediculus hominis, and the same technical term is used in animals also. It is pediculosis. So it is pediculosis. So we have studied about acariosis, pulicosis, and pediculosis. Because it has no extra host life cycle, we can easily destroy dog louse by administering any medicine, whatever it be. We are coming to the medicines. This is the chewing louse or the brown Trichodactylus canis or the black Trichodactylus canis. This is the sucking louse or the white Deinonychus setosus. And now we have the last macro parasite. Need not study the life cycle of all these macro parasites. We have a lot of mosquitoes. Out of that, those mosquitoes which are transmitting microfilaria, which forms adult filaria inside the body of the dog. We know, fortunately, we don't have this Dirofilaria immitis, which we commonly term as the heartworm of dog. We don't have it. But some sporadic cases have been reported. But we have Dirofilaria repens. The adult worm itself is a thin, slender nematode. During surgeries, we can come across with this, we can pull it out. Long, slender worms. That is Dirofilaria repens. So we have certain mosquitoes such as the Culex mosquito, the Anopheles mosquito, and the Aedes mosquito. See, the Culex and the Aedes, their longitudinal axis is always kept at an angle to the body surface. See this. The body surface is this, and the body of the long axis of the abdomen is kept in angles. But what about this Anopheles mosquito? The long axis of the body of the Anopheles mosquito and the surface of the body will be parallel. That is how we differentiate whether it is Anopheles or Culex and Aedes. So the Culex will be having angular body, the Aedes will be having angular body with the joints will be white in color. Joints will be non-pigmented. And the Anopheles mosquito will be keeping their abdomen parallel to the surface of the body where they feed. Then we have the tabanus striatus, is a horsefly which can even transmit trypanosomiasis. Then we have the phlebotomus or the phlebotomus argentipes, which transmits leishmania, leishmania infantum. So these were the ectoparasites which we encounter commonly in association with tick-borne or vector-borne diseases. How we can control all these ectoparasites? No need to teach you. You know very well than me, because you have been encountering these problems and doing lot of things like this. We can use tick fleas or sprays. Tick or flea sprays. We can use fipronil spray. Fipronil, at first, there was a boom in fipronil. One pharma came with the fipronil and all the pharmas, one after the other, produced fipronil and they were marketing. And the quality of fipronil is now lost. Can any of the doctors show that nowadays we can kill the tick or the flea with the fipronil? It is very difficult. I am not going to brand any new good thing, but pure fipronils are there still now.
Hatford Pharma introduces Enrohat DT 200 tablets, Enrofloxacin 200 mg, fluoroquinolone antibiotic systemic drug to clear these susceptible infections with healing touch. Enrofloxacin 200 mg tablets, Enrohat DT 200 tablets. Uses and indications: used in dogs and cats for management of bacterial infections susceptible to enrofloxacin, lower urinary tract infections, enteric infections, and bacterial skin infections. Dosage for dogs: 5 to 20 mg per kg every 24 hours, at least 2 to 3 days. For cats, 5 mg per kg every 24 hours. Route: oral. Presentation: 1 into 10 tablets. You can book your order online at www.hatvet.com. Looking forward to a long-lasting business association. Thank you. Hatford Pharma introduces Enrohat 10 syrup, Enrofloxacin 10 mg per 5 ml, fluoroquinolone antibiotic systemic drug. Now, easiest way to administer enrofloxacin in small breeds or exotic animals. Yes, enrofloxacin in syrup form, Enrohat 10 syrup. Enrofloxacin oral solution 10 mg per 5 ml. Uses and indications: use in dogs and cats for the management of bacterial infections susceptible to enrofloxacin, lower urinary tract infections, enteric infections, bacterial skin infections. Dosage for dogs: 5 to 20 mg per kg per day every 24 hours for at least 2 to 3 days. Cats: 5 mg per kg every 24 hours. Route: oral. Presentation: 60 ml. You can book your order online at www.hatvet.com. Looking forward to a long-lasting business association. Thank you.
But most of the fipronil products from most of the pharma are useless, and the ticks and fleas will eat the fipronil and they will be happily dancing on the dog's body. But the advantage of tick fipronil is that the toxicity is minimum. Toxicity is minimum. And so it can be safely used even on the pups and kittens. That is the only advantage of fipronil. And fipronil, lot of fipronil spot-ons are available. Fipronil spot-ons of different ages, different body weights, etc. are available. Selamectin, the ivermectin spot-ons are available. But the best medication I have seen nowadays is not the fipronil or selamectin, only the oral medication. For oral medication also we can use ivermectin chewable tablets, but that is not most effective mostly. But fluorelaner, I have seen that it is very effective to eliminate all the ectoparasites on the skin. No need to say fluorelaner, no need to hide anything, no need to hide the company. There is only one company which manufacture and they distribute this fluorelaner in our country. It is MSD. So fluorelaner is available as Bravecto. Bravecto we have seen in my hospital also. I have more than 50 numbers of Bravecto tablets. Very expensive. It is, the MRP is 2000 rupees. And the largest tablet, the MRP is 2600. So it is very expensive. But one tablet will give you protection against ectoparasites, even micro ectoparasites, the mites, etc. One tablet will give you protection for 3 months. That is what we have to convince the client. Even though it is expensive, we can use that. Tick collars can be safely used. They say according to the company also, it is waving. The protection is fluctuating like 3 months to 5 months or 6 months. Imidacloprid tick collars are available. Flumethrin tick collars are available. They all give a minimum protection of 4 months. Then we have powders such as Propoxer. Propoxer powder is available. 1% the Propoxer powder is available. Carbaryl dusting powder is available. Propoxer and Carbaryl, the companies say it should not be used in pups and kittens. But I have seen that it is extremely safe in pups and kittens. See why they say? Because there is no transcutaneous absorption for Propoxer or Carbaryl, but they may lick it. See, we cannot see any pup licking of the whole body, very small pup. They will always be playing. They won't be spending their time for licking the whole body, grooming, etc. No. So it can be safely applied twice or thrice in a week if the small pup is having ectoparasitosis. Especially this Propoxer. It is having a pleasant smell also. Then a lot of shampoos are available which contains cypermethrin. We can use a shampoo. We can use a shampoo. Shampoos are available. Then tick or flea dips can be used. The main thing we know is amitraz. See, while we are dealing with amitraz, we should know about the bitter aspects of amitraz. Amitraz is a dangerous liquid. Amitraz in human beings is absorbed transcutaneously. So, amitraz after absorption, it will block the insulin receptors so that glucose metabolism is inhibited. There will be hyperglycemia. So that's a big issue that we have to warn the client. See, client education is very important. See, our oath, the second paragraph of our oath says, I will practice my profession conscientiously with dignity and in keeping the principles of veterinary medical ethics. This is our etiquette. We should warn, or we should teach or educate our client, because whatever I am giving, if I am dispensing amitraz to my client, first I will ask whether you are diabetic. No, of course that is good. Otherwise, you don't dilute it by your hand. Better give it to somebody else. Let them go and dilute. My dilution is 4 ml per liter. Okay, go and dilute it. If you are diluting with your bare hand, it may be absorbed transcutaneously into your hand. Somehow this fellow is having diabetes, especially type 1 diabetes. Where insulin is needed. Unfortunately, we do not know this fellow is having type 1 diabetes. What will happen? It will be absorbed transcutaneously from his hand. It will block the insulin receptors. There is reduced carbohydrate metabolism. Hyperglycemia occurs, and the patient may go to hyperglycemic shock, and sometimes he may die. So, all this depends upon our education. So, also, amitraz is contraindicated in certain breeds. For example, Chihuahua. In Chihuahuas, there is transcutaneous absorption. So, it should not be applied onto the skin of Chihuahua. So, also to cats, there is a little bit degree of transcutaneous absorption. Another thing is that it will be licking, because no topical applications, or topical application should be controlled in the cat. They have a habit of licking always. Another thing is that you can give bath with the cypermethrin, or you can apply amitraz on the dog. It is a custom that after giving the bath with the anti-ectoparasitic shampoo or applying the anti-ectoparasiticide, let freed into the sunlight. They will go to the sunlight, they will have a sun bath, and they will try to dry up their skin. If sunlight is touching the body where the body is sprayed with this cypermethrin or amitraz, whatever it be, it will be inactivated. So ask the client not to let it be freed to the sunlight. It will be inactivated. After application of these medicaments, whatever it be, it should be kept inside the house, inside the kennel, or onto a shade. Not to direct sunlight. Okay, that you should keep in mind, and you should advise the client also. Then we can use deltamethrin. We can go for deltamethrin is available as 1% lotion. It is a pyrethrin like cypermethrin. Fenvalerate lotion and fenvalerate powder is available. Cypermethrin lotion and cypermethrin powder is available. And to get rid of this menace, we can use even injections.
Hatford Pharma introduces Azithrohat 300 tablets, azithromycin 300 mg, the cure that embraces with care. Azithromycin tablets 300 mg, Azithrohat 300, macrolide antibiotic systemic drug. Indications: broad spectrum antibiotic against gram-positive, gram-negative, and other organisms. Example: Mycoplasma pneumoniae and Borrelia burgdorferi. Antiprotozoal effect against Babesia species and Toxoplasma species. Dosage for dogs and cats: 5 to 10 mg per kg once daily for 3 to 7 days. Route: oral. Presentation: 1 into 6 tablets. You can book your order online at www.hatvet.com. Looking forward to a long-lasting business association. Thank you. Hatford Pharma introduces Azithrohat syrup, azithromycin 250 mg per 5 ml, the cure that embraces with care. Azithromycin oral suspension 250 mg per 5 ml, Azithrohat syrup, macrolide antibiotic systemic drug. Indications: broad spectrum antibiotic against gram-positive, gram-negative, and other organisms. Example: Mycoplasma pneumoniae, Borrelia burgdorferi. Antiprotozoal effect against Babesia species and Toxoplasma species. Dosage for dogs and cats: 5 to 10 mg per kg once daily for 3 to 7 days. Route: oral. Presentation: 30 ml. You can book your order online on www.hatvet.com. Looking forward to a long-lasting business association. Thank you.
When you are giving these injections, the active principle will be circulated in the system, and this will affect only those blood-sucking parasites. We know ivermectin. Ivermectin is extracted. It is water insoluble. It is oil soluble. It is an oily extract of the fungus Streptomyces avermectilis. They are collectively known as avermectins. You have the ivermectin, doramectin, epinomectin, moxidectin. Lot of mectins are there. So these are avermectins. They are GABA potentiators. So we have the fipronil spray. Fipronil spray can be used. Its safety margin is that it can be safely used in kittens. It can be safely used in cats. It can be safely used in pups also. In my clinic, when tick infestation is coming, I will give a bath with a cypermethrin shampoo. After that, I will pat it dry inside my beauty parlor. Then my nurse, she will spray the whole body with the fipronil spray. And after that, I will give a shot of ivermectin injection. Then an oral Bravecto tablet. Then only I will let them out. This is the protocol that I follow. A cypermethrin bath plus after the cypermethrin bath, pat dry, complete fipronil spray, massage, ivermectin shot, a Bravecto tablet. I am sure that all the ectoparasites will go. Nothing to worry. This is what I do inside my beauty parlor. So that was regarding the fipronil spray. I don't claim that it is very effective, but when combined with other things, see earlier when fipronil was produced or marketed earlier during the first preliminary times, it was very effective. Now not so. Anyway, to a certain extent we can use the fipronil like this. Then we have the fipronil spot on. Sometimes some clients come to me, they personally ask me regarding spot ons. There only I do fipronil spot on. That can be applied, but personally speaking, it is not effective. But that my hospital is my industry also. I have to earn my bread and butter from the hospital, so that I sell it, or so that I don't sell it, I will put those or I will apply those on the back, then charge for it. Salamectin, of course, we have Revolution. Salamectin spot on is there. That also can be used. Salamectin has a bit more upper hand than fipronil. That is what I feel. Ivermectin chewable, that was a good medication before this Bravecto has come. Nowadays, I am not doing this ivermectin chewables. Bravecto is an excellent therapy. This tablet is a wonderful tablet. This is a chocolate itself. When this is torn open, the dog will begin to salivate because that is purely chocolate. That has a taste of chocolate, smell and flavor of chocolate. Everything is excellent. The dog will like it very much. Playful dogs, they will immediately grab and swallow it. Excellent. They are marketing it in 5 different varieties, like 250 milligram for 4.5 to 9.5 kilograms, 10 to 20 kilograms. They are marketing it in 500 milligram tablet, then 750 milligram, 1000 milligram, 1600 milligram. Those things are there. Those are a wide range of tablets are there. We can make use of it. That's excellent, and I recommend. Then tick collars can be used. Imidacloprid and fenvalerate tick collars are there in use. We can use it. It gives almost 5 months protection. Tick collars are excellent, but some tick collars are very expensive. Tick collars are nothing. It is impregnated medicine, imidacloprid impregnated tick collar. It is being applied around the neck and then fastened. It will give the dog protection for the dog. That's good. Only problem is with the cost. Flumethrin tick collars. See, Bayer, they markets flumethrin as well as imidacloprid tick collars. Then we have the propoxer dusting powders, abundantly available. It can be safely used onto puppies and also kittens twice in a week. Carbaryl dusting powders can be used. It is also safe. We can say it is safe. But if we are going to use this propoxer and carbaryl dusting powders onto very large dogs, it won't become feasible for the client because one bottle should be needed for one application. Cypermethrin shampoo is available for the dog. The only problem with cypermethrin shampoo is that after application, you should not allow the pet to go out to the sunshine and take a sun bath to dry themselves. It will inactivate, sunlight will inactivate cypermethrin. Sunlight will inactivate cypermethrin, then deltamethrin and amitraz. So better don't let it. Amitraz is a wonderful medicine. This can be applied on the dog skin as well as the premises against the emerging generation, especially the ticks and the fleas. But this cannot kill the cocoons. That is a problem with amitraz. For the cocoons, we have to burn it, or give the adult one a Bravecto tablet. So that if the adult one coming out of the cocoon, they will bite the dog, but they will immediately fall down and die. So amitraz can be used, 12.5% is available. On the body, it can be used up to 3 ml per liter, and on the floor and the canals, you can use up to 5 ml per liter. Deltamethrin lotion can be used. The only problem with the deltamethrin lotion is that, as I mentioned earlier, amitraz, deltamethrin and cypermethrin. After application of these three medicines, the dog should not be let out. And coming to amitraz, it is highly toxic or contraindicated for the Chihuahua breed. Somehow, see, I say that amitraz is contraindicated to Chihuahua. But my question is a twisted one. How many of you are able to identify a Chihuahua? It is our question. Unfortunately, I prescribe amitraz for a Chihuahua and his Chihuahua dies. He proceeds with a complaint. Definitely we will be hanged. We are responsible. But the problem comes that we saw the breed, but unfortunately we were not able to identify that it was a Chihuahua. It's a mistake from our part. So we will be penalized. So always our doctors should thoroughly know the breeds. Suppose ivermectin injection. Ivermectin is contraindicated for the collies. Rough collie, smooth collie, border collie. See, the border collie just looks like a mongrel dog. Sometimes we may be confused which breed it is. It's a collie. It's a border collie. If you give a single shot of ivermectin, it will die. You know what happens. It passes the blood-brain barrier, produces convulsions, and we will have to deal with the toxicity. So, ivermectin injection is contraindicated. Ivermectin is contraindicated in certain breeds. Like the border collie, smooth collie, rough collie. Okay, we have to identify these collies. It is contraindicated in Sarpalaninak. We have to see. I have a Sarpalaninak in my place in Kozhikode. Only one breed. I have to identify it. It is contraindicated in Caucasian sheepdog. It is contraindicated in English sheepdog. Old English sheepdog. It is contraindicated in Newfoundland breed. So all these things, who will come to identify all these breeds? We have to identify that this is a Sarpalaninak, this is a Newfoundland, this is an old Caucasian sheepdog. That is, Caucasian sheepdog just imitates a German Shepherd. Sarpalaninak also looks like a German Shepherd. Somehow if we give a shot of ivermectin to that dog, it will die. We will be penalized, we will be hanged, because that is a very expensive dog. So study the breeds, for heaven's sake. You have to identify the breeds. So deltamethrin, it can be applied onto the dog's skin, but not led to sunlight. Fenvalerate, of course, we have fenvalerate lotion. It is also, again, if the lotion is applied, don't let it out to the sunlight. It will be inactivated. Fenvalerate powder is also available. Ivermectin injection is available. We can inject to all dogs, and also to pug and the spitz. Calculate the total dose of ivermectin. It is 200 microgram per kg. Calculate it. Take only half the dose, then inject it. Because in the pug and the spitz, it may pass the blood-brain barrier and cause a toxicity. I have seen the case. So be very cautious. So, Jai Hind, my dear boys, my dear girls, Jai Hind, Bharat Mata ki Jai. And with this, I am concluding the series of webinars in vector-borne diseases and its management. So thank you very much for patiently listening to me.